Hi, everyone, and welcome to our presentation where
Pedro Palenzuela, Andy Fernández.
I'm Janelli Sarguello, and this project was developed for EAB 4795 Senior Seminar in Applied Behavior Analytics at Florida International University. Today, we're presenting our behavior intervention plan, which was designed to address a behavioral challenge that each of us personally relates to: procrastination. To give some context, we're all undergraduate students at FIU majoring in behavior analytics. Although we come from different backgrounds, one of us is married and balancing academic and professional goals. One was born in Cuba and deeply passionate about behavior science, and one is a US-born student with majoring in ABA. We all have one key challenge in common: procrastination. Let's start by defining the behavior. In one plan, procrastination is defined operationally in delaying the intervention. By delaying the initiation of an assigned academic task by engaging in unrelated activities. In other words, instead of starting homework, someone might scroll through social media or find other distractions. Functionally, the behavior is maintained by escape or avoidance, specifically avoiding the stress or anxiety associated with the task. This behavior has constantly impacted our academic performance and daily proactivity, whether it's feeling overwhelmed by whether to begin or getting distracted by social media. We're all experience how procrastination can interfere with meaningful process. Because of this, we choose to make it our focus on our intervention. Of course, addressing procrastination isn't straightforward. There are several barriers and ethical concerns we have to consider. One of the biggest challenges is that procrastination is often internal. It involves private thoughts, which is harder to observe or measure directly. This can lead to inconsistent data. Additionally, self-monitoring, which is critical to our plan, can be difficult when avoidance or low maintenance motivations are a part of the problem itself. From the ethical standpoint, it is important that we respect participants' privacy and create a supportive, non-judgmental environment. Since procrastination can bring feeling a guilt of shame and guilt, we made sure that our approach engaged self-reflection and growth, not criticism. Also, participants must understand how their data will be used and feel confident that their privacy will be respected. Before collecting or sharing any information, it is critical that they obtain information on set, clearly explaining the purpose of the data collection, how it will be stored, and who will have access to it.
To better understand the behavior and guide our intervention, we conduct a functional assessment using two tools: the procrastination assessment scale for students, FAST, and the functional analysis screening tool, FAST. These tools help us evaluate not only how long participants were procrastinating, but also why the behavior was occurring. The results gave us the information we needed to create a focus and function-based intervention strategy. The FAST helped us evaluate both the frequency and the reason for procrastination, especially in academic settings. It is a validated, wisely used tool that identifies factors like fear of failure, task awareness, and how long motivation as key contribution. On the other hand, the FAST provided behavior analysis lens. It supported our hypothesis that function of procrastination was escape from discomfort, especially stress or anxiety related to academic demands. Using Using both tools allow us to combine self-reported data with a functional understanding of the behavior.
Based on the results, we found that our participants were procrastinating for an average of 40 minutes per academic task, especially when it came to writing or presenting presentation. These tasks were seen as overwhelming, and the behavior served as temporarily reduce the negative emotion they trigger. Understanding this gave us a strong foundation for intervention, specifically one that addressed the emotional and environmental variables maintaining the behavior. To track our progress, we use multiple baseline design across subjects. Each participant baseline latency was consistently around 40 minutes. We maintained this baseline for at least 3 sessions per person, which helped establish a stable pattern before introducing the intervention. The goal of the intervention was simple but ambitious. Reduce procrastination by increasing task initiation. We aim to lower the latency from 40 minutes to 0 through self-management strategies rooted in behavior analysis. To determine success, we established mastery criteria. Latency had to fall below 2 minutes across 2 consecutive sessions. We choose latency. Why do we choose latency? Well, we choose latency because procrastination is not about task completion, it's about how long it takes to start. By tracking the delay between task assignments and initiation, we could clearly observe behavioral change over time. To ensure our data was accurate, we used operational definitions for both the antecedent when the task was present and the behavior when it was initiated. Even though this was a self-management plan, we simulate intra-server agreement by comparing log, timestamps, and trial recordings. This helped improve data reliability.
Once the intervention began, we closely monitor and evaluate the progress. Daily self-recording digital timers and logs help us keep track of the latency. Each week, we graph the data to visualize trends, identify any patterns, feedbacks, or improvement. This helps us easily to identify trends, whether the participants was improving, featuring, or regressing, and make the results more interpretable over time. We also review reinforcement systems, including the token economy, and make adjustments as needed. For example, if a participant wasn't showing progress, we revisited the reinforcement or prompt strategies to make sure they were still effective. To maintain integrity of the intervention, we conduct weekly fidelity checks, ensuring that tools like schedules and timers were being used consistently as intended.
Now we're going to talk about our treatment plan. The intervention took place in the home environment, where participants typically completed academic tasks. This allows the intervention strategies to be used in a real, relevant setting, increasing the chances of generalization and long-term success. We started with antecedent strategies, visible schedules with color-coded work and break periods, alarms and reminders, and a distraction-free workplace. These proactive tools helped reduce avoidance triggers and made it easier to begin tasks.
On the consequence side, we use positive reinforcement. Participants earn a token each time they initiated a task on time. After collecting 5 tokens, they could exchange them for a preferred reward, like watching a show or scrolling on social media. The idea was to make the initiation more reinforcing than avoidant.
We also introduce replacement behaviors, specifically routines that help participants begin their work gradually and with less reinsistence. Starting with small actions like opening a document or reading instructions help build momentum and reduce the environmental barriers to getting started.
To support generalization, participants participate in initiating tasks in various settings, including the library and classroom. While using the same tools, prompts, and reinforcements were faded over time to encourage independence, and tasks were varied to ensure that the behavior transfers across the context.
For maintenance, reinforcement was gradually reduced, while self-monitoring tools like checklists and visual schedule remained in place. Periodic check-ins and booster sessions were also recommended to sustain motivation and track long-term success. So what this data tells us, how you can see there is a clear and consistent reduction of procrastination across all participants. Latency dropped from 40 to 0, and every participant met the mastery criteria. That alone speaks to the effectiveness of the intervention. What's more, the data show low variability, meaning the behavior changes were stable across sessions. This consistency improved the reliability of our outcomes.
Overall, the intervention led to improved academic engagement and quicker task initiation. These results were achieved by combining self-management techniques, antecedent modifications, and reinforcement systems, all grounded in applied behavior analytics.
We did encounter a few challenges. For instance, it was hard to maintain motivation with less preferred tasks. To address this, we diversified the reinforcement options, added more frequent breaks, and made a small change in the visual schedule to keep things fresh and engaging.
Looking ahead, there are several ways this intervention could be expanded. We recommend incorporating long-term follow-ups to assess behavior maintenance, adding peer accountability, task relevance, and technology-based prompts could make the intervention even stronger, and continue refinement of self-monitoring tools and individualized reinforcement systems could enhance generalization and motivation across different settings.
Thank you so much for viewing our presentation. We hope it offers insights into how applied behavior analysis can be used to address everyday challenges like procrastination through a structured, functional, and evidence-based interventions. Thank you so much.